Good afternoon. I'm Dr. Jamy Ard, and I'm coming to you on Facebook Live from the Weight Management Center here in Winston-Salem. Glad to be able to spend the next 20 or so minutes with you talking to you about the Weight Management Center and what we do here, especially diving into some of the medical weight loss programming that we have. So a little bit about me. I'm a professor here at Wake Forest Baptist Medical Center, School of Medicine. I've been here now, I guess, about 4.5 years, and joined the faculty here after being in Birmingham for almost 10 years, and came here with the goal of helping to build a medical weight loss program that was complementary to our wonderful surgical program that was already here and directed by Fuzz Fernandez. So since I've been here, we've been able to build what I think is really a great team and a wonderful program that I want to spend the next several minutes getting to tell you about. So what do we do? Our medical weight loss program is really designed to help people who we feel like have generally struggled with their weight in terms of difficulty losing weight over maybe in the past several years, maybe lifelong. Or maybe they're new to weight loss. Maybe they've decided that they're trying to lose weight and just haven't been able to figure out what to do. And we see people who come in and decide this is something that they need help with. And the professionals on our team are here to help those individuals be successful with losing weight. And we use a number of different strategies. We use a number of different team members. And I'll go through those strategies and those team members a little bit later. But in general, our goal is to come up with a personalized solution for you that helps you be successful in losing weight and keeping that weight off. Because a lot of the people that we work with will tell us, yeah, I've been able to lose weight in the past, but I've had a lot of difficulty keeping it off. Or I've gone through a program in the past, and when I get to the end, I feel like I don't know what to do after that. I was just in weight loss mode, but wasn't quite sure, what do I do to help me lose weight long term and keep that off? So those are the types of things that we specialize in. We bring a really great team to help you be successful, and that team includes a number of different types of people. And this is really a key differentiator for us in terms of how we are different from lots of other types of programs that you might see in the commercial space or even in some other medically associated programs. So the first part of our team includes our medical team. I co-direct the center and serve as the medical director for medical weight loss for our programs. And I lead a group of physicians and nurse practitioners and physician assistants who are really here to help oversee the process of putting together a plan that helps you become successful. The reason we involve our medical team in the process because we also deal with people who have a lot of complications related to being overweight. That includes things like diabetes, high blood pressure, sleep apnea, lots of arthritis, and they may be on lots of medications that are really complicated. Some of those medications may even lead to weight gain. A lot of our patients will tell us, I saw 3 people last week who said, you know, I was normal weight until I got put on certain medications and then I gained weight. And that's really challenging. You don't know what to do and how to deal with that. And that's where our medical expertise comes in. And so our medical providers are really sort of there to help guide the process, help understand those medical issues and how that affects your weight, and can then help lead the rest of the team. The rest of the team includes our dietitians who are all specializing in medical weight management and have very specific knowledge and experience around how to help the individual who is looking to lose weight do so successfully with a good nutritional strategy. This is really important because a lot of times you may find that when you are out in the commercial space and looking for help to lose weight, some people may brand themselves as nutritionists, but that doesn't always mean that they actually have a degree as a registered dietitian with specialization in weight loss. So what does that benefit you? Well, what that means is this person is not just someone who may have lost weight in the past and can tell you a story or two or help motivate you by sort of giving you a rah-rah speech, but this is someone who has good understanding of the scientific evidence that leads to successful weight loss in a healthy and safe way. And so that's an important distinction in terms of our dietitians who are part of our medical team. We also have exercise physiologists and personal trainers that are part of our team because we understand that exercise is a critical part of the lifestyle change that you're going to be embarking upon. So we want to make sure that you don't find yourself doing things that you're uncomfortable doing, things that you don't really know exactly how to do it. Is this the right way to exercise? Because there is a way to exercise for weight loss, and there's a way to exercise for general cardiovascular health. There's a way to just be physically active that does not equal exercise. And so we help explain all of those differences to you, help you put together the right mix of things that will allow you to be successful. Then we also include behavioral health specialists, and I would say our behavioral health team is probably one of our more critical components of our team, especially when you think about how we are different from lots of other strategies. Most people will tell you, I know what to do, but it's really sort of trying to understand how do I get from what I know to do and then doing it on a regular basis. And that's the behavioral health bridge that we need to span. And our behavioral health specialists, that include psychologists and counselors, all help with both individual and group counseling to really get you from the place of just knowing what to do and implementing it in your day-to-day lifestyle. It's all about making that behavior change, and that entire team is really designed to help you be successful, put you in a position to be successful in a way that you couldn't even imagine that you could be successful. So working together as a unit, we all help to create this individualized plan that allows you to be successful. So let me talk about what that plan might look like and how we go about building a strategy for you. So we use two programs. We call them our by design programs, so designed just for you. And our first program is our Essentials program. The Essentials program is a 6-month weight loss strategy, 6-month program, and it's really designed to help promote somewhere around 1 to 2 pounds of weight loss per week. It again includes every member of the team as a part of that strategy, both individual and group behavioral counseling. Exercise training is a part of that. You may get 4 to 10 sessions depending on your insurance coverage and the program that you select. In the Essentials program, that program is really ideally suited for people who say, you know, I have some skills, I have some knowledge, I'm in a position where I feel like I can really take off and engage with food. I need some general guidance, but I'm really in a position to make good choices with the right amount of guidance. And if that's your situation, then the Essentials program could be a good fit for you. Again, average weight loss is going to be somewhere around 1 to 2 pounds per week. If you have medical conditions that are of a concern, we do have medical supervision as a part of that. And so we certainly can see people who have issues like diabetes and high blood pressure, high cholesterol, other medications that may be complicated as a part of the Essentials program. The other program that we have in the Weight Management Center medical program is our by design OptiFast program. Our OptiFast program, in comparison to the Essentials program, is designed to be a little bit more intensive and structured. And generally speaking, the OptiFast plan is really sort of structured for people who feel like, I need to really take a break from food, maybe a vacation from food, so to speak, where I need some help in sort of reformulating my relationship with food, because anytime I try to consistently make different choices or move into a different space in terms of how I deal with food, because I'm so emotionally tied to food, I feel like I'm using food as a friend, I'm using food as a way to cope with stress, I'm eating emotionally or eating for reasons that are other than really hunger, then this is a strategy that can help you. Because what it does is we use meal replacements as a way to get away from food for a little while, simplify the choices that you have to make. And so all you have to think about is, I just need to eat every few hours. And the meal replacements do the work for you in terms of not having to deal with food for a period of time. And then over time, we gradually rebuild your diet. So we reintroduce food and allow you to continue to still lose weight, but in a position where you're much more confident about now how you're going to approach food and deal with food moving forward. What we find is that people who are doing the OptiFast plan typically have about 17% weight loss, and they achieve a significant part of that through the first 6 months of the program. And then through the latter 6 months of the program, continue to gradually lose weight and move into a maintenance strategy. This is very effective for weight loss. The OptiFast program has been around a long time. We find that it's really effective for individuals who have lots of medical problems, that find themselves in situations where they may be concerned about the need to increase the number of medicines that they're on. So we see a lot of people who have type 2 diabetes, for example, and have been told that if they don't lose weight or don't modify their lifestyle, maybe they're going to now have to need insulin, for example. So the OptiFast program can lead to very quick initial weight loss, very consistent weight loss because of the consistency of the program. And the structure is really great for people who need that level of detail and that level of consistency in order to be able to move forward with being very consistent over a long period of time. The OptiFast program also involves both group and individual counseling, and it also involves personal training as a part of that. And so the goal is, again, using all the members of the team to provide you with the type of support that you need both in the short term and in the long term. Both of our programs, although we come in, and talk to you about those two basic programs, both of those programs are customizable for your particular needs. We know that no two people are alike, and different strategies will be required in order to help you be successful. So we start with those basic programs and then tailor them to your particular needs. And so you might have two people in the OptiFast program, but they may be approaching it from very different perspectives in terms of the individual strategies. Our medical team is also very well versed in using medication as an adjunct to helping people to lose weight. And we find that medication can be helpful both in the short term as well as in the long term for weight loss maintenance. So we incorporate that when it's appropriate for individuals to help them meet their weight loss goals and their health goals. Our team is really big on goal setting and really helping people to achieve not only their weight goals, but what are the things that you want to just do differently in your life? What are the things that your weight is keeping you from doing? Is it not allowing you to play with your kids the way you want to? Or are you limiting the places that you go because you're concerned that your weight is embarrassing or that your weight is prohibiting you from being able to do the things that you like to do? Is it physically challenging for you to get up and down and do the work that you need to do in and around your home? These are the things that we want to know about so that we can help you achieve those goals, and we bring all these resources to bear to help you get to that point. So those are the types of programs that we have and the teams that we have involved that help deliver that to you. I'll talk a little bit more about maybe how we're different and what you might expect if you were to come to the Weight Management Center. I think one of the things that we really sort of pride ourselves on is looking at the individual patient and understanding both medically, behaviorally, how does that all affect your potential for weight gain and your potential for being successful with losing weight. So we do a very comprehensive assessment when you first come into the Weight Management Center. That includes a set of lab values. We also look at resting metabolic rate. We want to understand physically what's your level of fitness at the initial part of the assessment. That allows us to really sort of do that tailoring that I talked about, to really create an individualized plan for you so that you have the best chance of being successful. That's a key difference in terms of how we approach the things that we do. The other key important point that I think separates us from different places is that we really focus on medical science. The members of our team are involved in lots of clinical research. We've been leaders in the field, and we know that in order for us to provide a good, solid, quality program for you, we need to have the evidence to support the things that we're doing. So we fully believe that all the things that we need to do for you have to have some science behind them. Otherwise, it's a waste of your time, it's a waste of your resources, and we wouldn't want to put you in a position where we're feeling like we're going to waste your time and resources. So let me then move on and talk about maybe some of the things that we see in terms of what happens to our patients and what are their successes. I think one of the things that really makes me excited about being here is that we get to come in every day and talk to our patients about the successes that they're seeing on a regular basis. One of our patients just talked to me and said, you know, he was really excited to come in and see us because he gets to share in that success in terms of talking about reducing medications or doing things that he couldn't do 6 months ago. And it's really part of the motivation for why I even decided to go into this field in the first place. There's not too much that you can do in medicine that really sort of changes an individual's life in the way that we see these changes happening. I think of one particular case of a woman who came in and talked to us over 2 years ago at her initial evaluation, and she pulled out a grocery bag full of medicines, and she said, I'd like to be off a lot of these medicines in a year. And I can tell you 12 months later, we ticked through the list of medicines and looked at all the medicines that she had been able to come off of simply because she had been so successful. She'd lost over 80 pounds and was still going, and felt like the benefits that she had gained were well beyond just the weight loss that she achieved, the improvement in her quality of life, and how she felt so great in terms of just not having to take all those medicines. So that inspires us. We want to see that, so we get excited to see you, and then you come in and you get excited to see us to be able to share that success with us. So it looks like we've had a question that's come in through Facebook, and the question is, the best diet to help my cholesterol? Well, I think there are a couple of different things that you can do to help your cholesterol that have been shown to be effective. The diet I probably tend to prefer the most is the Mediterranean style diet, because this diet is really good at helping to lower the bad cholesterol, which is the LDL cholesterol. That's the cholesterol level that we know is associated with heart disease. And the Mediterranean diet is really a nice option for people who are looking to lower the cholesterol, because what you do with the Mediterranean style diet is you increase your intake of fruits and vegetables, you decrease your intake of red meat, but you also increase your intake of fats. And the types of fats that you focus on are poly and monounsaturated fats. And the simple way to think about it, if it's liquid at room temperature, all right, if it's not a solid fat, but a liquid fat at room temperature like an olive oil or a canola oil, those are the types of oils that you want to use. And it's actually a relatively high fat diet, so it's very satisfying. You feel like you have choices, but I think it's a great option for people who are looking to try to lower their cholesterol using a dietary strategy. So that's a great question. Really appreciate you providing that question. So I think as I start to close up here, one of the messages I want to make sure that people understand is that the reason we have the team that we have in place here at the Weight Management Center is to be able to provide that type of expertise to you so that you can make a full lifestyle change and not feel as though I'm just going there to the weight loss clinic, because we're a lot more than that. What we are about is helping you make that full lifestyle change in an individualized way that's going to help you be most successful. Again, both in the short term and in the long term. That long term piece is really important for us, because once you're a part of our program, you're always a part of our program. You can always come in for group classes. you can always get an appointment. We want to be part of your long-term medical team because we understand that obesity is a chronic condition. And every day that you have to make a choice about being physically active and what to eat, you're going to need to make those choices consistently, and you would benefit from the accountability and support that our team provides. So I think that as I close up, I want to make sure that people, if you found this interesting, share this, like it on Facebook, visit our Facebook page for more really informative videos. There's lots of anecdotes and stories. We've got great stories about patients who've been really successful and have shared their victories. And we know that that inspires lots of other people. And so if you're thinking about, as the new year comes around and those resolutions are coming around, and you're thinking about, hey, I really need to get back into shape, or I've really struggled and I need some help, consider us and think about what we might be able to do to help you out in the new year. So if you have any questions, or you want to sign up for a seminar and come learn about what we do, in a little bit more detail, certainly you can find us on Facebook. You can go online through Wake Health and search Weight Management Center, or you can call our number at 336-716-6099. And thank you for allowing me to spend a few minutes with you this afternoon. Take care.